If you've been told your only options are shots that wear off and surgery you're not ready for, this video is going to change that. Most people believe cartilage is permanent damage. Once it's gone, it's gone. Manage the pain and wait for a replacement. That's no longer true. Researchers at Stanford, Duke, and in major pharmaceutical trials have found injectable therapies, some requiring just a single visit, that are showing in clinical trials they can structurally repair cartilage, reverse joint aging at the cellular level, and for some patients, eliminate surgery entirely. Here are the 5 most important things science has discovered, and the last one will genuinely surprise you. Cortisone shots last 6 to 12 weeks. Repeat use actually damages cartilage and weakens ligaments over time. Hyaluronic acid has a 37% reintervention rate within 2 years, meaning it stops working and you need it again. And as of January 2026, major insurers like Blue Cross Blue Shield of Texas have stopped covering it entirely. The standard playbook is being retired. Something better is replacing it. But this only matters if the replacements actually work. And one study tracked patients for 15 years to find out. Tissue Gene C is a single intra-articular injection combining cartilage cells with modified cells that continuously release a repair growth factor inside the joint. In April 2025, 15-year follow-up data was presented at the world's largest osteoarthritis research conference. In the control group, similar patients who didn't receive the therapy, 27.2% needed total knee replacement over 11 years. In the Tissue Gene C group, just 7%. That's a 74% reduction in surgery. And patients who did eventually need a replacement got an extra 5.7 years in their own knee first. 0 treatment-related tumors. Clean safety profile across 15 years. But here's something most videos won't tell you, and it explains why cartilage regeneration is harder than it sounds. In the landmark Forward trial, sprifermin, a recombinant growth factor, produced measurable, sustained cartilage thickening on MRI at 5 years. And yet, no significant difference in pain scores compared to placebo. Why? Because cartilage has no nerve endings. It literally cannot feel pain. Knee pain comes from the bone underneath, the inflamed joint lining, sensitized nerve fibers, not the cartilage itself. This is why patient selection is everything. These regenerative therapies work best in mild to moderate disease, grade 2 or 3 on X-ray, where viable cartilage cells remain. Bone-on-bone grade 4 disease is a different conversation. The earlier you act, the more these therapies can do. So what about patients who need pain relief right now, not in 5 years of tissue rebuilding? There's an answer for that too. Arthrosamid is not a drug. It's an injectable hydrogel, one shot that integrates permanently into the synovial lining of your joint capsule. It doesn't dissolve. Synovial tissue grows around it. It physically cushions the joint, restores lubrication, and blocks inflammatory signals from reaching the joint lining. Prospective 5-year trials show sustained pain and stiffness reduction from a single injection. No migration, no degradation. For patients who failed standard injections and aren't ready for surgery, this is a completely different category of treatment. And now, the most extraordinary development in this entire field. Inside your joints, there's a protein called 15-PGDH. It's a master regulator of tissue aging, and as it becomes more active, it breaks down the signaling molecule that keeps cartilage cells young and regenerative. Stanford researchers blocked it. In old mice, a single knee injection produced smooth, functional hyaline cartilage, the real thing, not the inferior fiber cartilage surgery typically produces. Then they tested it on cartilage harvested from total knee replacements, tissue already considered too far gone to save. 1 week of exposure. The population of healthy matrix-producing cells nearly doubled from 22% to 42%. Aging, degrading cells dropped by half. End-stage cartilage reactivated. Human trials are being fast-tracked under the federal ARPA-H program. If this translates to the clinic the way it's translating in the lab, the idea that joint aging is irreversible may not survive the decade. The standard injection playbook is running out, but the science replacing it is more serious and more promising than most people realize. The window that matters most is now, before the damage goes too far. If this changed how you think about knee pain, drop a comment below and subscribe to follow these phase 3 results as they come in over the next 12 to 24 months. This story is just getting started.